How's it going, modern manual therapy viewers? Dr. E here, back with another Top 5 Fridays, this time on variations on the ventral cervical retraction exercise. Cervical retractions are good for anyone with general upper quarter complaints, especially cervical pain, cervicogenic headaches. When you have a sensitized upper cervical spine, this tends to desensitize it. Many times it gets sensitized because it's kind of getting overloaded, getting compressed a little bit, getting very irritated from a lot of forward head posture. Not like posture actually relates to pain, but any more than knee flexion relates to knee pain. But you do need to avoid triggers, and kind of moving in the opposite direction or a more novel stimulus tends to reset those triggers. So the first one is a retraction with overpressure. Many times retractions work, but they don't quite completely abolish the patient's complaints, and you think you need to progress to something like retraction and extension. Very few times do you need to actually progress to a retraction extension if you really get to end range by placing the web space on the maxilla and then doing overpressure. So the cue should really be active retraction and end range overpressure. If they tend to push throughout, they almost isometrically push back against their hand, and they're not quite as relaxed as they should be. So end range retraction actively, push on the maxilla passively. I don't like to push on the mandible because that could sensitize the TMJ potentially or irritate an existing TMJ patient. Number two is isometric extension. Many times, if you've been spending all day, or a patient's been spending all day in retraction, or protraction, I should say, you tend to get a pinch or a feeling of compression or some pain in the upper thoracic spine. So resisted isometric cervical extension tends to modulate that pain. Then they can do the retraction under overpressure, pain-free. If they can't quite handle resisted extension, and will they try increase force or decrease force, because either one could potentially modulate that pain, what you're going to do is have them just lightly push their hand, rest their back of their neck in the hand, and just do some light nods. This often works well as a regression before someone can progress to retraction and overpressure. The nodding they'll feel a nice stretch in that upper cervical area, and it should desensitize it. If someone has more unilateral complaints, typically unilateral occipital headache, temporal headache, or upper trap pain, again, a good way to desensitize the upper cervical spine unilaterally is actually to rotate to the involved side. So in this case, right orbital, right temporal, right upper trap pain. They can do a light retraction, rotate 5 to 10 degrees to the right, and then nod to the right. So the variation might be 5 of these and 5 of these. And if you do that yourself, you can feel that nod to the left or nod to the right. You'll feel a little bit more in that upper cervical spine unilaterally. The last variation is actually skin slacking superior. Maybe the resisted extension didn't quite modulate that pain. Wherever you're getting the pain, maybe it's mid-cervical spine, maybe it's upper thoracic spine, you're just going to take your fingertips and push the skin superiorly. Skin slack is a great way to also to modulate pain or perception of pinch. So if I was getting my upper thoracic spine, I would retract to the point where I feel it, and then just push the skin superiorly. And now, all of a sudden, I don't feel that perception of pinch because I'm getting that novel stimulus through the skin. Maybe now I can actually do both. I can push the skin superiorly and then end range load in overpressure. I hope you like these variations. Remember, the whole goal is to get the cervical retraction to be as pain-free as possible, because dosage is what matters if you want the patient to get better when they're not at your office. So dosage is key, end range loading is key in these cases. If you like this video, make sure to subscribe via email to Modern Manual Therapy blog at themanualtherapist.com so you don't miss any of our awesome blog updates and get exclusive discounts on Edge Mobility System, which you should also check out for ISTM products, our BFR certs, full-on seminars, and more. Make sure you check us out on social media, modmt.com/Facebook, Instagram, YouTube, or Twitter. Whatever your social media platform of choice, you can just check us out there. I hope to see you at an eclectic approach course soon in 2018, and you have a great day.